Word on Health, the report with its finger on the pulse of popular medicine with Paul Pennington. Word on Health, for your very best of health. Restless Leg Syndrome, or RLS, also known as Willis-Ekbom disease, is a common condition of the nervous system. It causes an overwhelming, irresistible urge to move the legs. It can also cause an unpleasant crawling or creeping sensation in the feet, calves and thighs. The sensation is often worse in the evening or at night. Occasionally, the arms are affected too. Some people have the symptoms of restless leg syndrome occasionally, while others have them every day. They can vary from mild to severe. Julie Gould, a trustee with the Restless Legs Syndrome patient support charity, RLS UK, explains the two variants.
Primary RLS generally has no known cause, and it starts before the age of 40, and it can affect babies and children. It's often misdiagnosed as ADHD in children. Secondary RLS usually happens as a result of prescribed medication or iron deficiency, or as a result of other neurological diseases, for example, multiple sclerosis or Parkinson's disease. It tends to mainly affect older patients, but it can happen at any age. The main medications that can trigger restless leg syndrome are antidepressants, also sedating antihistamines, and medications that are used for coughs and colds can also trigger it. Some people will first get RLS after spinal operations. Damage to the spinal cord is also linked to RLS. I was first diagnosed with RLS during my second pregnancy in the third trimester. It's extremely common. And for most people, it disappears once you've had the baby. In my case, it didn't.
Is restless leg syndrome well understood by GPs?
Sadly not. GPs tend to think it's rare. It isn't. It affects up to 7.5% of the population to varying degrees. It isn't taught in the United Kingdom at medical school or during GP training. Sadly, it's not even taught during neurological training unless the particular neurologist has an interest in RLS.
RLS UK are campaigning for the inclusion of restless leg syndrome in medical training, and they also want to see an overhaul of how the way the condition is tested for and treated, given the growing evidence that the current frontline treatment for it can make patients' symptoms worse over time. New hope for RLS patients may be on the horizon, following a study involving British and German scientists in the largest of its kind research that could, it's claimed, potentially improve the lives of many millions of people in future. Dr. Stephen Bell, who co-authored the research, is from Cambridge University.
We compare the DNA of many people with and without restless leg syndrome to find specific areas which can be thought of as genetic risk spots. Our analysis was based on 1.5 million controls and almost 120,000 cases. We identified 161 genetic risk spots, and 139 of these were entirely newly discovered. So this represents an 8-fold increase in our knowledge of the areas in a person's DNA associated with risk of restless leg syndrome. Even while there is still work to be done, our findings can hopefully help move from journals to the clinic much more quickly. So, for example, we looked at the genes that were associated with restless leg syndrome and whether any existing drugs on the market were able to target them. One of the good things about this is all of these safety profiles of these drugs are known, they're used in current clinical practice, so the time taken to conduct the clinical trials needed to show that they're effective in the treatment of RLS can be drastically shortened, and they're also much cheaper to deliver.
Whilst this study may prove beneficial in the long term, turning back to you, Julie Gould, if someone is listening to this report and recognises that they too are living with restless leg syndrome, what steps would you advocate they take?
Don't suffer in silence. Join RLS UK. Our help forum will give you lots of useful information. Ask questions there on what you need to do before you actually go to your doctor to seek help and advice.
My grateful thanks to Julie Gould and Dr. Stephen Bell. To find out more and to link through to RLS UK, visit our website, wordonhealth.com. That's wordonhealth.com. Word on Health, for your very best of health. The prostate is a small gland in the pelvis and is part of the male reproductive system. It's about the size of a walnut and is located between the penis and the bladder and surrounds the urethra. Prostate enlargement is a very common condition associated with aging. More than 1 in 3 of all men over 50 will have some symptoms of it. In fact, on the day that King Charles shared the news that he had a problem with an enlarged prostate, there was an 11,000% increase of visits to the relevant NHS website, and Prostate Cancer UK saw an almost doubling in the number of users of its online risk checker. It's not known why the prostate gets bigger as men get older, but if they notice any problems with or changes to their usual pattern of urination associated with it, they need to get it checked out by a doctor. In many instances, this can be simply addressed. For others, it may be a sign of something more serious. Meg Burgess is a specialist nurse with Prostate Cancer UK.
Most early prostate cancers don't cause any symptoms at all. But if there are any changes, whether those are benign changes or possibly because of a prostate cancer, it might cause changes to your waterworks. So possibly a slower flow or starting and stopping of the flow or a dribble, having to pass water more frequently, especially at night time, or a feeling that you haven't completely emptied the bladder. Other symptoms that might indicate a problem could also be any blood in the urine or semen, or any bony pain as well, particularly in the lower back or hips. Those are things that a man should be speaking to his GP about.
As part of this year's Men's Health Awareness push, the Men's Health Forum have launched a new guide, P for Prostate, to help men get a better understanding of their prostate and to further encourage them to come forward if the symptoms you've described are causing concern. There is currently no national screening programme. What about tests?
The first test that may be used to look at risks of prostate cancer being present is the PSA test. It stands for prostate-specific antigen, and that's a protein that's produced by the prostate. So the test is looking for a higher than normal level in the bloodstream.
There has been criticisms that it's not as accurate as it could be.
At the moment, it's the best test that we have as a starting point. The main disadvantage is that it can come back for a high level for reasons other than prostate cancer. But the advantage is, for many men, it is the first indication that there's a problem, and we then go on and do further tests.
There's been some debate about the causes of prostate cancer, but I understand there are certain factors that raise the possibility of a man developing it.
The incidence will increase as men get older. The other risk factors that we know about are a family history. If you've got a father or a brother that's been affected by prostate cancer, then that will increase the risk. And the other risk factor is ethnicity. So we know that black men have a higher risk of developing prostate cancer compared to white men.
It has to be said the survival rates of newly diagnosed cases of prostate cancer have increased significantly. So any man listening to this report and who identifies with what's been highlighted in it is going to be helped by talking to their doctor as soon as is possible. I read about the push for more effective tests and the evolution in treating cancer in all its forms in the future. How do things look for male-specific cancers?
We need a better understanding of the aggressive or the non-aggressive types of cancer, as potentially in the future we'll be able to much better individualise treatments for men more confidently. And we need more treatments and access to treatments, especially for men that are living with advanced disease.
My grateful thanks to Meg Burgess. To find out more and to link through to Prostate Cancer UK or the Men's Health Forum, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health, your personal prescription for your very best of health.
Alcohol is part of many of our lives. We use it for celebration, for comfort, to socialise, to wind down, to cope. It's legal, socially acceptable, even encouraged. Yet every year in the UK, alcohol-related harm leads to thousands of lives lost and hundreds of thousands more damaged. Much of the harm from it, death, illness, violence, neglect, comes not from dependent drinkers, but from those drinking at high levels, who would still be considered by many to be normal drinkers. Research suggests many of us see alcohol harm as something that happens to a small group of dependent drinkers who do not or cannot control their drinking, and who are mostly beyond help. But as Marley from the charity Alcohol Change UK explains, that's not the case.
Alcohol harm is something that affects all of us. We live in a society where alcohol is always in the spotlight, whether that's through the marketing that we see or the role that we let it play in our own lives, where maybe it's taking focus away from the friendships and the relationships that we have. It's really not necessarily about how much an individual is drinking, although clearly your risk can increase if you're drinking at very high levels. It's not just about the very serious conditions, it's also about the quality of sleep we're having, the effect on our relationships, anxiety, even our finances. No harm from alcohol is inevitable. Everyone can change their own relationship, could support someone else to change their relationship with alcohol and lessen the risks that you're experiencing.
Is the charity you represent anti-alcohol?
No, Alcohol Change UK isn't anti-alcohol at all. We just want to end the harm that alcohol causes. And that's possible. We encourage and help people moderate how much they're drinking. Our Try Dry app is really helpful for doing that. So we're not saying you shouldn't drink alcohol at all. Really, it's about being aware that when you are drinking alcohol, you've made a conscious choice to do that and you know how much you're drinking. So it might just be that you set yourself a target using our app of 4 days during the week when you're not drinking, or the number of units that you'd like to drink to keep within that safe limit of 14 units per week.
How important is it that we're supportive of people who choose to limit the amount of alcohol they drink or abstain from drinking it altogether?
It's really important that whatever people decide, whether that's to be permanently alcohol-free and don't want to be drinking alcohol or choose to drink sometimes, that they're comfortable to do that and they're supported, and we get rid of the kind of sober shaming that often happens, when you're out in a pub with friends and you're choosing not to drink. That should just be a normal decision. There shouldn't be any judgment attached to that.
As part of this year's Alcohol Awareness Initiative, what are you encouraging us to do?
What we want people to do is to think about the impact that alcohol is having on their lives and the lives of people around them, but also think about the changes that we want to see across society, whether that's reducing stigma and shame that's attached to alcohol. We really need to end that so that people are more free and comfortable talking about their own drinking or the drinking of a partner or a family member or a friend, but also changes that we'd like to see across society that protect people from harm. By starting conversations, we think we can really create change.
My grateful thanks to Joe Marley. To find out more and to link through to Alcohol Change UK, to access the app we've highlighted, and to get further help and support, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health, for your very best of health.
Dubbed the disease of kings and queens, if you thought gout was an outdated condition affecting portly, red-faced Victorians, think again. 1 in 40 of us now have this extremely painful disease. Its claimed cases among people in their 20s and 30s have increased by 30%, and across all adults in the UK over the past few years, cases of gout have surged more than 200% in some parts, top of the league being Liverpool, with a staggering 960% increase, and the symptoms can be excruciatingly painful. Lynsey Conway is from the UK Gout Society.
It's the most common form of inflammatory arthritis worldwide. 7 out of 10 new cases are in the big toe. Usually onset comes in the middle of the night, and some people say they can't even bear the bedclothes touching the affected joint. It can affect other joints as well, though. It's really debilitating. If you're having an attack, some people can't wear shoes, they can't drive, they could be in pain for up to 3 weeks if they're not properly medicated, and left untreated could lead to deformities.
Lynsey, do we know what causes gout?
Gout is caused by too much uric acid in the bloodstream. And uric acid is the waste product created by the body when it breaks down purines. And purines are a type of protein found in many foods and all our body cells. And what happens is when you get increased or raised levels of uric acid, gout occurs if your kidneys can't get rid of the uric acid, either because they're not working efficiently. As you get older, your kidneys don't work as well, or you might have a genetic disorder. 1 in 10 people will inherit gout from a family member. Men are twice as likely to get gout than women, although we do see more and more women around the menopausal age who are getting gout. According to some new data, gout is on the increase amongst the young, and that's probably due to a number of factors, but possibly the rising obesity epidemic.
Can gout be cured?
There are very accurate tests around for gout, such as a simple blood test, which your GP can perform, which can detect the amount of uric acid in your blood. It is eminently curable. There are basically 3 ways of treating gout. The immediate way is to treat pain and inflammation. There are 2 groups of drugs. One which helps to prevent further attacks, which a lot of people end up taking the whole of their life. And then there's those that help you get rid of the excess uric acid. But you can also help yourself. With the initial pain, it's important to raise the affected joint, use an ice pack, and drink lots of water.
Alongside taking whatever medication you're provided, being a healthy weight and taking regular exercise with activities that don't put too much strain on your joints, what other self-help measures can you take to reduce the likelihood of gout reoccurring?
We know that you need to reduce your alcohol intake because a lot of alcohol is high in purines. We know that certain types of meat are more purine heavy. Some vegetables are. It's really about maintaining a well-balanced, healthy diet.
My grateful thanks to Lynsey Conway. For further information and to link through to the UK Gout Society, visit our website, wordonhealth.com. That's wordonhealth.com.
Keeping you in touch with the health and lifestyle issues that matter. This is Word on Health with Paul Pennington.